Hi everybody, thank you for coming along. My name's Tanja Phillips and I'm a GP by background, and I now have two medical aesthetic clinics and I'm setting up my third one now. But I started about 7 years ago with no knowledge of lasers, no knowledge of the industry at all. So what I'm going to speak to you about a little bit today is how to get started in that industry if you have no knowledge at all, and a little bit about why I chose the particular device I chose and why I think it's really special and how it's helped me to progress through my career in the aesthetics industry. So just so I get a little feel about who's here at the moment. So has anyone at the moment got any devices in their clinic? Yep, okay. And is anyone just starting out and looking to get their first device? Okay. So what I'll do is I'll go through a little bit about my journey, and there should be some tips and things that you can pick up along the way. So I started just over 6 years ago in my clinic, and there was just me, and I decided to go for a Fotona laser because it was a multi-platform laser and it delivered so many different treatments. So that was the reason I went for that. And I progressed then from one clinic and one room, literally hiring a room for half a day a week. And then that's progressed more and more to now being busy 6 days a week and having a number of staff with me. And there was only one of me at the beginning. So I'd invested in the equipment, in the machine, and I didn't have anything else to invest in anybody else. So I had to learn really quickly myself. So one of me, one room, one laser, and zero experience. So I very quickly learned how to use the Fotona laser. It's quite a simple device to use. It's got dual energy platform of erbium and ND-YAG. But the key with it was this multifunctional platform. So how can you start with just one device and one room? I think for me the key was getting results for my patients. So there's no point setting up with a device that's not going to deliver, because immediately you've lost your credibility with your patients, and you're starting off with a few patients and you want to build on that. So it's got to deliver. You need a machine that's super reliable, that's not going to break down. And with the Fotona laser, it's just got a very, very good track record. All of the engineers will say it's one of the devices that they don't get called out to. It just doesn't break down. And you need a machine that's going to give you a really good return on your investment. So with the laser device that I chose with Fotona, you can deliver skin tightening, lifting, smooth eye mode, so you can treat around the eye area, you can treat snoring. There are so many different things that you can treat. So once you've got your device, there are no consumables. So you've got it, you've invested in your product, but what you don't need to then do is pay per treatment for anything else that you're using. So there are no consumables. You've got your device, you've got your hand pieces, and that's it. Your investment is done, bar you paying for the electricity to use the device. And the support that I got from Fotona was very, very good. So as well as my initial training that I got with the device, the additional training that we get is online too, so you get face-to-face training, and then there's an app called My Fotona and a website called My Fotona, which has got instructional videos on, and literally your hand is held throughout that process. Something for everyone. A multi-platform device means people coming into your clinic, which is the hardest thing, getting them in the first place. Once you've got them there, you want to be able to treat them. You don't really want a device whereby they're going to come in and say, oh, actually, I need skin tightening, and you've only got a vein treatment device. You need something that can deliver on everything. Reliability of the machines is key, and a lot of the clinics now have had their Fotona lasers for 10, 15 years plus, and they have a few of them as well. You need upgrades. So as there are new techniques coming onto the market, new technologies, what you can do with your device is actually just have uploads onto your existing system. So you're not constantly buying a new device and a new device as new technology comes along. And that's been really key for me. No hidden costs, and Fotona are really ahead in their R&D. So there are papers, research to back up everything that they do, proper clinical studies, histology to prove that it's actually delivering what it says on the tin. So this is the device that I started out with, and I now have 3 of these within my practice. It's got a whole load of applications. So most of us know patients will come in and they'll sit down in the chair and they'll go, I just want this, this little simple thing, and they want it with no downtime and they want it to happen quickly. You can deliver that with this machine Because of its unique mode, smooth mode, you can actually treat inside the mouth and you can get high energy levels inside the mouth. And I'm going to explain a little bit more about that afterwards. You can treat around the eyes, lid lag, you can treat wrinkles, aging, you can treat snoring, you can actually treat incontinence. So there's some trials going on at the moment for vaginal incontinence and atrophy, rosacea, acne, stretch marks, the list goes on. So that's why it's such an amazing device. And it doesn't do all of those things badly, it does all of those things really, really well. So what is this non-ablative erbium? So for those of you that know devices, you will know that erbium classically is an ablative laser. But Fotona have managed to make it non-ablative by delivering micropulses. And that's brilliant because it gives results similar to ablative treatments, but without any downtime, which is phenomenal. And that's what the patients are wanting. It's super safe to use, so you don't have to be a medic to use it as well. Great advantage when you're looking at a business model, and you get reproducible results. So who does it benefit? Well, it clearly benefits the patients. They're getting great results with no downtime. From the clinician perspective, you don't have to be a medic to use it, so you can have other people within your clinic. For me, I've got 3 now laser specialists that deliver treatments within my clinic. And they can do almost all of the treatments there, apart from the fully ablative treatments and skin lesion removals. And for the business, fantastic return on your investment. So I made my money back on my machine within 3 months, and that's been replicated by a number of clinics that have bought their machines. So although it's a high-end machine, because of what it does and because of how effective it is, you get your money back very quickly with it. So a lot of people, when I talk about non-ablative laser, those people that know their lasers will say, kind of, is that really a thing? Does it actually work? But it does actually work. And it works by delivering a treatment that is non-ablative, but giving you the results of ablative treatment. And no other laser has this. So you are unique if you have this. This is Fotona's USP. So as I was saying, you've got little pulses being delivered, so micropulses being delivered in one long pulse. And that delivers energy deep into the tissue, so you're getting that collagen stimulation. Again, those of you know your lasers will know that traditionally erbium does this, so it ablates the skin. You're making holes in the skin, and that's normally how most devices work for stimulating collagen. You injure the skin then responds by producing more collagen. It stimulates the skin to produce more collagen and to tighten existing fibres. With this, we just deliver micro pulses into the skin, not damaging the surface. You can then add stacks onto this in the same place, and you can get good depths of penetration and great results with it without it touching the surface. So post-treatment, people can go back to work, they can go for lunch, no one would know they'd had anything done with a laser. And the other thing that's incredible with it is you can treat mucosal tissue. So you're treating epithelial tissue, but you can also treat mucosal tissue. So inside the mouth, you can treat, so you get really high energy levels inside the mouth, much higher than you can on epithelial tissue, giving even better results to patients. So times have changed a lot. So from ablative cutting lasers, we've now moved on to this non-ablative erbium. What I'm going to go through with you is a few very different things that this non-ablative erbium can deliver. So you can actually treat snoring, you can actually stimulate hair growth. So for patients that have started to lose their hair or have got thinning of their hair, you can use a laser to actually stimulate that. So it works in a unique way that I'm going to explain a little bit more of in a few slides' time. You can use it on its own, or you can use it as a combined therapy with PRP or mesotherapy. 4D facelift is doing the magic of this, treating intraorally. You can treat the eyes, you can even lip plump, so you can treat inside the lips and outside on the lips in a non-ablative way to give stimulation that you need over that area to give you gentle lip plumping. So not the same, obviously, as fillers. And you can use it to skin tighten anywhere on the body. And also you can treat vaginal dryness and incontinence. So the first thing I'm going to focus on is something slightly unusual, which is snoring, which I'm sure many of you at the moment don't offer treatments for in your clinic, and there's a good reason for that. We're looking at aesthetics, but snoring is has a massive impact on our society. Nearly 50% of men and a large number of women. suffer with snoring. And thankfully, 85% of these individuals, the snoring is palatal snoring, so it's due to a floppiness at the back of the throat. And what smooth mode does with Fotona is it stimulates the collagen in that area and actually lifts that area. So you're stopping that vibration noise, so you're actually improving the airflow and you're stopping snoring. So this has a massive impact on people's lives, both on the individual and also obviously on their partners too. What's really important to do is to assess your patient in the first instance. So you can assess your patients with questionnaires. You can also score them with a Malampati classification. So you're looking at the back of the mouth to see where they are to start with on their journey. And it's really important, if you're going to be delivering something, that you can evidence to the patient that something has changed. And the other amazing app is Snore Lab. So this is something that you can download onto your phone. So I get all of my patients to download this app onto their phones in the first instance. They then monitor their snoring for as long as they want pre-treatment. So I would say a minimum of weeks worth, ideally even more than that. And it gives you a scoring. So what this app will do is it will monitor through the night. You've got this app on, you press start when you go to sleep, you turn it upside down on your bedside table and it will monitor the snoring. And you see it monitors it quiet, light, loud and epic for those really loud snorers. And then it monitors the length of time that you've been snoring for during the night, and it gives you this thing called a snore score, which is a summary of what it's kind of amalgamated through your night's sleep. So this is a really good empirical way of measuring pre-treatment and post-treatment. So it's not just that, you know, my wife or my husband has nudged me a few less times in the night. It is evidence-based, so you can see that it's made a difference. Again, that this non-ablative erbium is used. You don't need any local for it, so you're not using any sprays in the mouth. There's no pain afterwards. The maximum you would get is maybe a slight scratchy feeling for 5 minutes after the treatment. That's it. And it's 3 20-minute treatment sessions. So day 1, day 15 and day 45. And that's all that you need for it. After your first session, you notice a difference generally of about 50% reduction in your snoring. How it works is by stimulating collagen remodeling. You're tightening the existing collagen there, which is why you get that immediate effect, because obviously it takes longer for new collagen to form. And that initial tightening would start to wear off if you just did one session. But because you boosted at 2 weeks and then again at a month, you've got that neocollagenesis stimulated, and you will then maintain that for a year. And then at a year, you need an additional session. So how do you do it? What you're doing with the laser is initially you're stimulating around the anterior pillars and just that retromolar area. So lovely picture there of it being. You then treat the soft palate and the posterior third of the hard palate and the uvula with the laser again, stimulating collagen. And then you treat the posterior pillars and the tonsils. So this is an area that many of you won't have treated before, but it's a very simple treatment and can be done by practitioners. You don't have to be medical to be able to deliver this treatment. So here's a little clip of what you're doing. So you're stacking these smooth mode pulses in each of these areas. Really safe to do. It's not causing ablation, not causing burning. All that the recipient might feel is just a little bit of heat there, and that's it. So as you'll see from a lot of my slides, they all get tested on my family as well and my friends. So this is my brother's Snore Lab test. So he did some sessions beforehand using Snore Lab. I treated him that evening, and this was him the following 2 nights. So straight away there was over 50% reduction. So he will be due his second treatment in, I think it's about 5 days' time. So he will soon start to notice that slight reduction because you've got that instant collagen tightening, and then his second treatment will reboot it again. So patients come back because they've seen the difference and they can evidence it on their own phone. So we'll show you a live demo of that, but I'm going to go through a few of the other special treatments that you can do with this non-ablative erbium. So hair growth stimulation, and how is that even possible just with laser? So we know that a lot of people suffer with hair loss. So postmenopausally, women are suffering with hair loss, and chaps also significantly suffering hair loss. Even in their younger years, I've got a number of patients in their early 20s who are coming for hair stimulation. So this is just by using laser light, and it's a super comfortable treatment to have. It just feels like a little bit of heat going over the scalp. So how can this possibly work? So you're stimulating growth factors, you're creating new extracellular matrix proteins, you're increasing vascularization there. So it's a multi-faceted way of stimulating the hair growth in the hair follicles, and you can awaken dormant hair follicles. So that's just a summary of what you're doing. So you're increasing the hair density as well as the thickness of the hair. So you can actually thicken the shaft diameter by this treatment. So you can use this on its own or in combination with PRP and mesotherapy. So if you use it in combination, you'll enhance the results even further. So as you can see, it's really easy to use. You're literally just putting the laser over the hair. Really, really simple to do, not difficult to do at all. And just parting the hair and putting the laser over it. So what Fotona are working on at the moment is a hair brush to deliver this treatment. So a hair brush will go over the hair and stimulate the hair follicles. But for now, we're using this. I'm getting great results with this. And this shows what people are getting with results with purely laser. So there's no PRP in this, no meso with this, no minoxidil. This is just laser results. And I'm going to move on to another treatment you can do with this smooth mode. So treating around the eye area with a laser is obviously quite a scary thing to do. So if you're using Nd:YAG or ablative laser, clearly you want to be avoiding the eye area. But because this is non-ablative, you can use it really close to the eyes, and you can use it over the eyes as well. Again, because it's non-ablative, practitioners can be using it. So you need to be level 4 laser and light therapist or above, so you can use this for that. Really simple to use. So you'll be able to see a close-up in a moment. So you're just delivering the energy over the upper lid. You deliver it down the side for the crow's feet and underneath for any puffiness and tightening under the eyes as well. It feels a little bit prickly, so I would say this is the only one that I might use a little bit of LMX for. None of the other treatments would I use any kind of local for at all. But this is the only one, just because it's slightly sensitive around the eye, that I might use a little bit of local for. And it's such a simple treatment to deliver. You do several passes above, underneath and down the sides to get those results. And as with a lot of collagen treatments, it's 3 sessions to maintain those results then for the patients moving forward. Family and friends and me this time. So this is my eye over here. This is my eye 4 years ago. So I was getting quite a lot of kind of lid lag. I've got quite a lot of crepey skin underneath. This was after 1 session, 2 sessions and 3 sessions of treatment. Normally I'd be treating at 4 to 6 weeks, but being a typical doctor, I left it late each time, but I still amazing results with that. The lighting, unfortunately, on that last one isn't quite as good as I'd want it to be, but you can see these are just natural photos that I've taken in the clinic. This is my sister-in-law. She was getting a little bit of lid lag, but puffiness under the eyes, which a lot of patients complain of. And again, she just had 2 sessions and it tightened underneath the skin there. And actually hers has lasted her brilliantly, even on just 2 sessions. And it does more. So, lip lays. So I've gone about my career in the aesthetics industry the wrong way round, really, compared to most people. I started with laser and then I've progressed on to injectables, whereas most people start the other way round. So this seemed like a really safe treatment for me. Obviously, if you're doing fillers, there's a risk of VO. This is nice and safe, so I never get those slight palpitations that you might get when you're sticking a needle into someone's lips. So it's a gentle way of treating the lips. What you're not going to get is the great big lips, but what you are going to get is this lovely plumping that's gentle, natural, and following the shape of the lip, because you're not adding any product in. You're just improving hydration, you're improving collagen, you get improvement in the colour of the skin, and no injectables. And there are some patients that just don't like needles. It's a great way to go. And quite a lot of my younger clientele actually really like this, and it probably hits my younger clientele and my older clientele really nicely. Demonstration of how you use it intraorally. So you're getting a high energy levels intraorally, and then you use it on the external part of the lip with lower levels of energy, because the skin is different there than it is obviously on the mucosal tissue, so you can't use as much energy there. All of that is non-ablative. and the kind of results that you can expect to get. So you can see subtle changes, gentle changes, in keeping with how the patient looked in the first instance, and as you can see, a variety of ages that we treat with it. But it beautifully increases the colour and the shape in a very natural way. So some patients will love this kind of treatment, and for me, it suits my patient population brilliantly. Generally, again with this, 3 treatment sessions spaced about 4 weeks apart. And then the bit that Fotona is probably most known for is their 4D facelift treatment. So this is 4 layers of treatment that you have, starting inside the mouth, then treating externally on the skin. So you're on the phase 2, you're treating with something called FRAC 3, which helps with pigmentation too. I'll take you through the following slide, which will show you. So slide 1, intraoral tightening. So this is non-ablative erbium that you deliver with a very special handpiece. So the handpiece that they've devised looks a bit like a test tube, and I'll demo that for you after. So you'll be able to see how it goes in the mouth, and it directs the energy levels all the way around the mouth as you move that laser handpiece through. Step 2, FRAC 3, is high peak powers ND-YAG. So this helps with pigmentation, redness, inflammation, and stimulates collagen. Step 3 is a longer ND-YAG pulse duration, so tightening the skin, so stimulating deep collagen tightening. And then at the end, using erbium in its more traditional sense in an ablative way, so this gives a light peel at the end. So depending on your skin type, you may leave out the superficial erbium for skin types 5 and 6 potentially. And this shows you how you're placing the tube inside the mouth. So this again will be alien to a lot of you treating inside the mouth, but the results are phenomenal by doing this. So you're directing it in all of the areas inside the mouth. And although this isn't a particularly nice photo, it demonstrates where we're depositing all of that heat and all of that energy. So this lower jowl area that everyone wants lifting, you can deliver the energy right down there and get a great improvement in that lower jowl area, as well as nasolabial folds and marionette lines. So you'll see on the before and after photos that I'll show you in a minute, you can get great improvement in that area. So treatment-wise, very simple to do. So you're just literally directing the tube in and around the mouth area. And the sorts of results you can expect. So the first 2 are from not from my clinic. So you can see the improvement there in the nasolabial folds. Obviously, you can treat men and women with this. You just have to adjust the parameters slightly. These ones are from my clinic. So you'll notice these ones say 5D on them rather than 4D. So the difference there is I've started to introduce using that non-ablative erbium externally on the skin as well as intraorally. And I found it gives an even better lift over these areas. So these ladies have had just 3 treatment sessions with the laser, and you can see nasolabial folds, marionette lines, significantly better. This lady, obviously, she had quite a lot of pigmentation, so it's helped with the pigmentation, lifted all around that area. They're delighted with the results. They still look like them. These have no fillers, no Botox. It's purely just laser. And again, you can see on these patients here, fantastic lifting around this area. And even on the older patients, it has a great result. So often with collagen stimulation, you're restricted in your age groups. And I would say the majority of my patients for collagen stimulation that I treat are between the ages of about 40 and about late 60s, early 70s. So as patients hit their late 70s, their collagen is going to be more difficult to reboot and to create that kind of effect that you want. Some patients still want to go for it, but it's just counselling them appropriately as the results that they might expect at that stage. But the genuine before and afters, I think, are really helpful to show patients what they can realistically expect to achieve. And as I say, I do fillers and Botox, but a lot of my work is down the route of laser. And then if you needed to do anything else afterwards, by all means, you can add that in. But most patients, when they've gone through this, are actually very happy and don't want anything else. So as I say, these are purely laser and nothing else. So for me, the Fotona has been an absolute game changer, really, in my career. As I say, started off doing general practice, moved into this field knowing nothing at all. with my one little machine. And the business has just progressed and progressed. So the things that I've found a massive difference with in my clinic is obviously you can help your patients sleep better. So no snoring, they're happy, their partners are happy. You can have more hair in all the right places. Sad thing is, as you get older, you get it in all the wrong places. So this can help you both add hair where you want it, but it can also remove hair. So the Nd:YAG part of it can do your hair reduction. You can treat your wrinkles, but in a very natural way, so you still look like you. You're not looking like somebody else. You can enhance lips, but without any risks attached to that. And you can improve the unwanted consequences of the menopause and childbirth without any medication or without needing surgery. So all of this can be achieved with just one machine, and we haven't touched on the Nd:YAG part of it that treats all of those other aspects of veins, acne, rosacea and so on. So it's a unique platform that I've found has made my business really successful, which is why I've gone from 1 to 3 machines now. And you can pretty much get your return on investment within 3 months, I would say maximum 2.5 months at a push with the treatments that you can deliver. Any questions on what I've presented here before we go through and do a demo?